Welcome to this second MOOC. Here I will introduce the main applications where plasma medicine has already shown proofs of concept as well as promising outlooks. The outlines of this MOOC are as follows. First, we will focus on wound healing and dermatology applications. Then, advances in plasma dentistry will be introduced. And finally, we will address the utilization of cold atmospheric plasma in cancerology. Let's start first with the wound healing and dermatological applications. Wound healing can be roughly considered as a 4-step process. The hemostasis is the first phase. Here, the objective is to stop the bleeding. A fibrin mesh is produced by thrombin to reinforce the platelet clumps into a stable clot. The inflammatory phase consists then into cleaning the wound. Bacteria, fungi, viruses are destroyed and debris removed thanks to the action of agents such as neutrophils and macrophages. Then, the proliferative phase is marked by neovascularization, the formation of new blood vessels. The wound margins contract and pull towards the center of the wound, and epithelial cells are generated until the wound is covered with epithelium. The fourth phase is a phase of maturation characterized by the reorganization of collagen fibers and an overall increase in tensile strength. Cold atmospheric plasma can have positive effects during all these phases. As an example, we will now consider the inflammatory phases where plasma can be used for decontamination purposes. In wound decontamination induced by plasma, a first randomized trial has been performed in 2010 by the Max Planck Institute for Extraterrestrial Physics in collaboration with the University of Regensburg and the Munich Schwabing Hospital. 36 patients were solicited. They presented no cancer but chronic ones, and most of them presented venous ulcers, the others being arterial, diabetic, and traumatic. The plasma treatment was performed using the microplaster plasma source for an exposure time of 2 minutes per day. These pictures show the results obtained before and after the treatments on a 61-year-old patient presenting venous ulcers. At the first day of plasma treatment, bacteria such as Klebsiella oxytoca and Enterobacter cloacae were detectable. And after the 11th treatment, so 23 days later, the swabs were sterile. The figure on the right indicates the bacterial charge on wounds exposed to the microplaster device and wounds exposed to argon gas. One can clearly observe a decrease 2 times stronger in the case of the plasma treatment, minus 67% of bacterial charge, while only minus 35% was obtained for the control, the non-ionized gas exposure. Plasma can also have an effect on coagulation. This mechanism, also known as clotting, changes blood from a liquid to a gel in order to form a clot. The activation, adhesion, and aggregation of platelets is required, as well as the deposition and maturation of fibrin. In this picture, incisions have been performed on the thighs, the upper legs, of SKH1 mice at the saphenous vein, which is a superficial vein. 2 cases were considered: control and 15 seconds of plasma treatment. As shown in these 2 pictures, the plasma can significantly improve blood coagulation at the wound surface. So now we may wonder, what are the mechanisms hidden behind coagulation enhanced by plasma? One of the first benefits of plasma treatment is the activation of coagulation factors. In this figure, the concentration of prothrombin is plotted as a function of time. The instant t0 corresponds to the incision performed on the skin. First, if one considers the case corresponding to the natural coagulation, a maximum threshold of prothrombin is obtained at 30 seconds, with a value as high as 1.54 micromole per liter. Now, if the same injury is exposed to the cold plasma, one can clearly observe that the same plateau of prothrombin is reached, but in a twice shorter time lapse, only 15 seconds instead of 30 seconds. Therefore, the plasma treatment does not permit to reach a higher prothrombin concentration, but at least it can allow to catalyze its production rate. The effect of plasma on anticoagulated blood has been investigated by observing the morphological clot layer using a scanner electron microscope. In the control, several platelets remain inactivated and some red blood cells intact, and on the contrary, in the plasma treatment, the platelets have been strongly activated, leading to their aggregation and to a high production rate of fibrin filaments. Cold atmospheric plasma can also be used for epithelialization. This process corresponds to the covering of denuded epithelial surface. The cellular and molecular processes involved in initiation, maintenance, and completion of epithelialization are essential for successful wound closure. Mettelman and co-workers from the Greifswald University, the LPST, and the University of Alabama have utilized a CO2 laser to perform a superficial wounds on the forearms of 5 volunteer patients. Then they used the kinpain plasma source to treat these wounds, and the results were evaluated 10 days later by blinded observers. It has been considered that short-term plasma stimulation repeatedly applied for 3 days looks to be the most effective wound treatment in terms of early aesthetic recovery. Now let's see how cold atmospheric plasma can be applied in dentistry. Dentistry is an important and historical application of plasma medicine. Cold atmospheric plasmas are explored owing to their advantages compared with conventional approaches. They can create higher sterilization levels than those obtained in conventional treatments. They can treat and sterilize irregular surfaces and limit heat transfer to healthy tissues. Today, the two main problems under study are teeth disinfection and teeth whitening. Teeth disinfection is a current intervention in dentistry, and one of the major issues is to keep a healthy periodontium. The periodontium corresponds to the tissues that surround the teeth and provide support. First, we have the alveolar bone, which corresponds to the foundation of the tooth that ensure its stability during mastication. Then the periodontal ligament, which is a set of fibers that attach the tooth to the alveolar bone. The cementum, which is a film covering the root in which the fibers of the ligament are inserted, and the gums or gingiva, which constitute the skin of the mouth that protect the alveolar bone. Those tissues can be altered by a set of inflammatory diseases regrouped under the name of periodontitis. This can involve a progressive loss of the alveolar bone and eventually the loss of the teeth. Enterococcus faecalis biofilms are usually present in chronic apical periodontitis. Yinglong Li and co-workers from the Peking University in China have evaluated the antimicrobial efficacy of cold plasma therapy in disinfecting 3 weeks Enterococcus faecalis biofilms. They have compared this antimicrobial efficacy with conventional treatments: calcium hydroxide, chlorhexidine gel, a combination of both, and finally plasma treatments. The results are reported in this figure where bacteria populations are expressed in CFU. The plasma treatment leads to a larger decrease in bacteria population, and this decrease is time dependent, as can be observed here on this second figure. Hence, a treatment as short as 12 minutes is sufficient to eradicate Enterococcus faecalis, while the other conventional treatments have still populations close to 4. Then the biofilm viability has been observed by confocal laser scanning microscopy. The green fluorescence observed before the treatment is characteristic of the bacteria alive, while the fluorescence turns to red after the cold atmospheric plasma exposure, hence proving their eradication. Also, it is worth mentioning that pulpal dentin remains unaffected by the plasma treatment. Its microhardness as its roughness remain unchanged, whatever the plasma exposure. Another important application in dentistry is teeth whitening. Here, Guomin Wang and co-workers have treated human teeth using a plasma jet supplied in air. They have compared conventional methods such as blank gel and H22 plus cold light with 2 hybrid plasma treatments, blank gel plus H22 plus plasma and blank gel plus plasma. The whitening effectiveness has been evaluated using spectrophotometry and the CIE color classification scheme. Whatever the treatment time, the blank and gel plasma combination appears as the most effective treatment for tooth whitening. Radicals from the plasma phase, such as O, OH, and NO, could play a dominant role in the process of plasma tooth whitening. The last part of this MOOC is now dedicated to the therapeutic effect of cold atmospheric plasmas observed on tumors. Mark van Damme and co-workers from the Grimmie Laboratory have studied the effect of cold atmospheric plasma on colorectal carcinoma. the HCT116 tumor cell lines has been injected into murine models, which have then been divided into two groups, the control group and the test group. This second group has been treated using a floating electrode DBD for time exposure of 6 minutes. Then the tumor activity of the two groups has been monitored by bioluminescence upon 1 month. In the tumor group, the tumor activity increases exponentially versus time, while in the plasma group, the activity is at least 6 times lower. After the plasma treatment, a decrease of cells percentage in the G0, G1 phase has been obtained. Simultaneously, the cells in the S phase rise from 13 to 20% after plasma exposure. An accumulation of cells in S phase together with apoptosis induction suggests an arrest of tumor proliferation. A large amount of reactive oxygen species can damage DNA, inducing a multi-phase cell cycle arrest and subsequent apoptosis. Another example of carcinoma are the pancreatic carcinomas. The treatment of the pancreatic carcinoma has been investigated by Brûlé and co-workers using a plasma gun supplied in helium with a repetition frequency of 2 kHz and 13 kV of voltage. The tumor cells are injected in the murine models and 3 days after tumor induction, mice are assigned into 4 groups: the control, conventional treatment with gemcitabine, plasma gun treatment, and combination of plasma gun with gemcitabine. In this first figure, the volume of the tumor is measured versus time. It is striking to observe that the tumor regression is higher using the plasma gun than the conventional treatment. Moreover, the combination of both leads to a dramatic decrease of this tumor volume. Similar trends are observed in the second figure, where the tumor weight appears as the lowest by combining the conventional and the plasma approaches. The mechanisms induced by cold atmospheric plasma on tumor regression are still under study. Among these mechanisms, it appears that plasma can first activate the p53 protein. This activation leads to the arrest of the cell cycle between G1 and S phases. The activation of the p21-CKS inhibitor is also possible, as well as cell cycle modification or arrest. Finally, apoptosis can be performed according to different mechanisms. The action of amino acids through membrane damage or lipid peroxidation, the activation of intracellular signaling pathways, the creation of mitochondrial dysfunctions, and intracellular runs, reactive oxygen and nitrogen species, generated by cold atmospheric plasma. In that latter case, one has to distinguish direct and indirect approaches. In the direct approach, the ROS penetrates from the extra to the intracellular medium, for example, by plasma-induced electroporation, hence leading to the production of intracellular ROS and to the damaging of intracellular DNA. In the indirect approach, the intracellular ROS can be stimulated without any penetration of exogenous radicals. This stimulation can lead to the production of intracellular ROS and therefore to the DNA damaging.